So we will go ahead and get started. My name is Kara Latham. Welcome to Grace Presents, our new webinar series that's really been designed to support seniors and the families that we have the honor of serving in hopes of educating and also having just some real conversations. Sometimes they're not always the easiest of conversations. And we will be talking about noticing cognitive changes during the holiday season, which a lot of us have experienced. And before we get started, just a couple of housekeeping items. We are recording this, and also we will be able to share it out after if you want to share it with any friends, families, colleagues, etc. And then if you have questions during the session, please feel free. You don't need to hold those, just pop them into the chat. You should see a question button on your screen. So feel free to do that, and we'll be answering questions throughout. And with that, I'm going to go ahead and turn it over, or actually rather introduce Ashley, who is our guest speaker today, Dr. Ashlea Smalley. So welcome. Thank you so much for kicking off this webinar series with us. We're very, very excited to have you here.
Thank you. I'm very happy to be here.
Awesome. We'd love to, before we get started, we'd love to hear a little bit about you. Again, for people who aren't familiar with Grace Management, Inc., we own and operate many communities across 23 states. And again, we've had the honor of serving seniors and their family members for over 40 years. And we operate active adult, independent living, assisted living, and memory care across the country. And again, delighted to have you here, Ashley. I'll let you kind of jump in and talk about your background and why you're so passionate about seniors in general, but also memory care specifically.
Yeah, thank you so much. So I feel like a little bit like I was born into senior living. My mom and dad actually met in a nursing home when they were in high school. It was both of their first jobs. And I'm from a small town, so my aunt and uncle worked there also. And then I worked there, and my great grandma lived there. And so I've always just had a very strong affinity for older adults. And then when I was in high school, my great uncle actually developed Alzheimer's disease. And then a little bit later on, my grandfather did. So that really became the direction that I pursued for both education and career as something that was really important to me. I wanted to make sure that whatever I was doing, I was able to serve older adults, and especially those living with cognitive changes.
Great. Excellent. Well, thank you. Again, we're super excited to have you here today. Before we jump into the content, I do just want to take a minute and ask a question to our audience here. And just really curious to see who is on with us today. There are a lot of people like myself who are in that sandwich generation, people who are raising children and juggling work, and also trying to navigate aging parents and what that journey and experience is like. And then there's also a lot of, loved ones that are on and caregivers. So great to kind of understand who's on. Ashley, are you able to see the results on your end?
I don't see results yet. I just see the poll.
We'll give you guys just a couple more seconds to do that. Definitely looks like there are a lot of people on that have an aging parent, which is, again, just really grateful to have you on the call today. We hope to add a lot of value and arm you with some good material as you, go into the holidays. So great. Okay. Excellent. So I think it's important to kind of level set with terminology. I feel like a lot of people use dementia and Alzheimer's interchangeably. So I thought maybe coming from you as an expert, Dr. Smalley, you could kind of inform us about this. And just to note, you're not a medical doctor, but you do have very impressive credentials as well.
Thank you. I went to school until I finished. Yes. So with dementia and Alzheimer's, a lot of people use it interchangeably. And for me personally, if you're not a clinician and an expert that works in the field, I don't think it's that big of a deal. Technically, Alzheimer's disease is a type of dementia. The graphic you're seeing on your screen right now kind of shows that dementia is the umbrella term for all of these other disorders that impact cognitive functioning. The one thing these all have in common is that they are progressive and will get worse over time. And they all impact cognition in a similar but also different ways. Alzheimer's disease is the one that we know about the most because it's the most common one that impacts older adults.
That's helpful. That is helpful. And that makes me feel good to know that I'm not giving the wrong answer because it is tricky and people use them all the time in different ways. So I think when we talked about launching our new webinar series, we thought this was a perfect first start because we all see these. Again, we have a lot of adult children, people dealing with aging parents and heading home for the holidays. But some of the things that you see or hear throughout the communities and so forth, Ashley, if you would just kind of talk through what that looks like and
Yeah, absolutely.
great.
As we age, our bodies go through changes that are very normal. Our brains go through changes that are normal. What we're talking about today is a little bit beyond that, where it's cognitive changes that are starting to impact day to day life. And those things are easier to hide during normal day-to-day routines. I'll tell you a little bit about my grandparents as we kind of go through this. But when my grandfather was diagnosed with Alzheimer's, it was a bit of a surprise to most of the family because him and my grandma did a very good job of hiding all of these subtle symptoms. But when we started to do family gatherings, things that were a little less routine oriented, some of that would start to show through, and especially now kind of retrospectively looking back. So what we're going to talk about today are just those very early subtle signs. And just kind of a note, if you're recognizing some of these things, it's not a guarantee that, oh, this is cognitive change, it's dementia. These really are just indications that there could be something going on that your loved one needs support with. So don't get like, I'm not diagnosing anybody today as we go through these. These
That's
are
right.
just things to look for.
That's right. And I think as we were going through this material, we were all like, I do those things. So stress also is a factor and there's
Yeah.
different medical conditions and so forth, but I think that's very well noted. Thank you.
Yeah, no problem. So I think the first one, and these are all, you can find all of these on the Alzheimer's Association website as well. This is their guidance. The first one we talk about is memory loss that disrupts daily life. I think with thinking about dementia or a specific diagnosis like Alzheimer's disease, we all think about memory loss, right? So what that could look like if you're in a big family gathering, something kind of new and different for the holidays, is someone who is asking the same question many times and not realizing they're asking the same question over and over again. Difficulty recalling recent conversations you had. If you just spoke to your loved one a week ago, they don't remember that conversation at all. That would kind of be a sign that maybe we need to look a little bit further in this. The other thing that you might see, and these are good tools, but if you find that your loved one is relying very, very heavily on memory aids, like making notes for themselves, setting alarms, reminders, that might be an indication that they're noticing some changes in their own memory that you would kind of call to be more attentive to.
Ashley, we had a question come in, and I can attest to this personally as well. My grandfather had Alzheimer's. Um, but when you're getting those repetitive questions, like how do you answer them? Like, do you change up your answer every time? Do you have, I don't know what the right thing is. I still to this day don't know what the right thing is, but someone asked that as well.
Yeah, so I think the most important thing is if someone's asking you a repetitive question, the likelihood is that they don't realize they're asking you multiple times. So if you get short tempered or snap or like, I told you this already, that's okay. That will happen. But the likelihood is they don't realize that they've already asked, which is why they're asking again. So kind of one of the strategies that we employ in our village neighborhoods is when we have a resident who's asking repetitive questions, we answer it every time like it's the first time they've asked. And then we also try to help them find the answer themselves. So if it's about a doctor's appointment, for an example, we might write them a reminder note and put it in their purse or their wallet. And so then the next time they ask, they can say, hey, I think you've got a reminder note about that in your wallet. Do you want to check? And then they can look and find the information themselves.
Ah, I like that idea. Great.
Next up is challenges in planning or problem solving. So during family gatherings, this might show up as difficulty managing the logistics, right? Normally they might have been the host. They planned all these things, lots of moving parts, who's bringing what for the menu, and that might be a lot more difficult. You might also see challenges in recreating a familiar dish, right? This actually comically happened with my family. Last year, my grandfather was known for making pies, and he swapped sugar for salt in one of them on accident. turns out more of a vision impairment for him than a cognitive impairment, but it was assigned to us, ooh, something has gone a little bit sideways here. So just paying attention to those types of things that you might see your loved one struggling with. The other kind of piece of this is maybe taking a lot longer to do things. And here's the thing, we do expect our older adults to be a little bit slower at things. That's completely normal. But if it's really egregiously taking a lot longer time than they normally would, I would pay attention to that and see how I could support them with whatever that task is.
Great.
Difficulty completing familiar tasks is another one that's kind of along the same lines. This would be things like getting lost, going to a familiar location. And this is something that can be very serious and might be an indication that driving is not a safe thing for them to do anymore. With my great uncle who developed Alzheimer's when I was in high school, this was one of the big indications to us. So, and it happened around the holidays. My aunt was getting ready to prepare a meal. She needed some items from the grocery store. So she sent him to Walmart with a list. Walmart was 10 minutes away from their home. And it took over 4 hours for him to get home. And everybody was very concerned, very worried. Where did he go? What's going on? Did we call somebody? And when he came back, we asked, like, what took so long? What happened? We were so worried. And he was like, oh, well, I got tired on the way. So I pulled over and took a nap. Which, like, in one hand, it was great that he recognized I'm too tired to be driving right now. But on the other hand, pulling over on the side of a road on a rural road 10 minutes from home is not great judgment. So this is some of the things that indicated to us it's time to really start investigating what's going on.
Right. And there are definitely recently a very dire situation where that happened. A couple coming home from Thanksgiving and pulled over and didn't ever make it home. So I think, well, I know we're going to talk about kind of what to do when you notice these things, but to do something, right? To not just brush it off is important if things don't feel right or look right.
Absolutely. Trust your gut on those things.
Absolutely.
Next up is confusion with time or place. This is another symptom that you might say is pretty common in when you're thinking about somebody living with cognitive changes. During the holiday season, this might look like losing track of dates or times, or even where they are. If you have a loved one who like takes a nap in a recliner during a family event and wakes up and doesn't know where they are, I would say that's a red flag that you'd want to look into. Missing a family gathering, those types of things too, which are normally really big deals, right, for a lot of people to make sure that they're spending time with their loved ones during the holiday. And if they miss that because they confused the day, that would also indicate we need to check what's happening here and why maybe we're losing track of time. Next up is difficulty with understanding visual images and spatial relationships. So, and this is a symptom that can actually indicate a lot of different conditions, many of them treatable. But if you notice your loved one is having issues with balance, just kind of increased clumsiness, like I'm walking through a doorway and I clip my shoulder because I'm not aware of where that doorway ends, or I'm reaching for a glass on the table and I miss or I knock it over, that type of coordination, judging distances, and vision impairments with contrast can be indications that there's something going on cognitively. And this also puts them at really high risk for falls, which is something we really want to avoid in our older adults.
Right.
Next up would be difficulty with words or speaking and writing. So what you might actually see this look like is somebody who you're having a conversation with and they stop speaking in the middle of talking, just kind of abruptly lose their train of thought, have difficulty calling people or things by the correct name. We have a resident who came in and her cover right, early on was that she called all of her very young great-grandchildren Babe. Everybody was Babe because she couldn't quite figure out who was who anymore. So that was an indication to her family that we needed to look in a little bit further here of what was going on with Grandma. And then social withdrawal. This is something that we experienced with my grandpa specifically, and it was so subtle because look, my grandma talked for both of them all the time anyway, so he was kind of a quieter guy, but during family events, and this is something we look back on now as a sign, he really started to kind of withdraw, sit in a corner and do a lot of observation and a lot less participation in the family events, card games, things like that. And we realized later that it was because he was having a really difficult time tracking the conversation.
Interesting.
misplacing things, with the caveat here that it's difficult to retrace steps. We have
Okay.
all at one time or another, this is where I say, like, don't worry, we've all done this. We've all put, the milk in the cupboard and the cereal in the fridge, at one point in time or another. But this goes a step further than that, being able to correct it, but not recalling why you walked into a room, where you just were, what you were even looking for. So things like I put a cup of coffee in the microwave to reheat it, and I didn't remember it, and there's beeping in my house, and I don't know where it's coming from. I can't even place that. Those would be a more like worse degree of that kind of
Sure.
general forgetfulness that happens to us when we're stressed.
Right, right, right. Yes.
And then decreased and poor judgment. So this might not look like impulsivity or making bad choices, right? Like in a very obvious way. How this will likely manifest is going to be things like less attention to personal grooming or cleanliness of the home, or even really being susceptible to those kind of scams of like the mail in the money and then we'll send you this back, those types of things. Which we noticed that a lot with my uncle. The Blood Buster's Clearinghouse really got him. And then for cleanliness in the home too, it might not be overt. This is really something that can be hidden. This is another situation where we had a family come to us because their mom had a medical condition, and then they came to us because when they went to go to her home to pick up items for her from the hospital, they found that her spare room was just filled with things, garbage bags of things, because they would come visit every week. So they thought they knew her front room and her kitchen were always clean and put together
Sure.
because she would put things in bags and put them away behind a door. And that it really created a lot of issues. And they realized that their mom's cognitive functioning really wasn't what they thought it was, but she was so good at covering that. So
Right.
some of this is very subtle.
Right. I have a question.
Mm-hmm.
So, do social situations with families typically increase or decrease stress for older adults? Curious if that can be a factor for things like forgetting the right words to use. Would that play a factor with the holidays and family gathering? And how could you know if that was the cause versus actual cognitive impairment? Would it present differently for each
Yeah, so I think let's take the first part of that. Do family gatherings stress people out? Probably. It really,
Right.
I think it will. Honestly, it depends on your individual personality. It depends on your own personal family dynamics. There's a lot of nuance in that. I think a lot of times for older adults, doing anything outside of the normal routine can feel a little bit stressful, kind of regardless. I think when how you know if there's a difference is you pay close attention. How are they outside of these family gatherings too? And maybe it's you need to take a little bit more time and spend some more time with them one-on-one to kind of just get a better feel of, is this something that's consistently happening in other areas of life as well? Or is this just related to there's 25 people in this house and like there's kids running around and there's a lot of dynamics happening. So it's really going to depend on who your loved one is. Do they love that kind of like family chaos, or is that something that is a little too much? So take this kind of as you have to filter it through who your loved one is as well.
Okay. Do we typically see more than one of these
Yes.
signs, right? Like if we're only seeing one area, would that not be an indication of other issues, or would we see multiple areas?
Yeah,
Multiple.
you would see multiple areas kind of where they're showing these subtle signs.
Okay,
You might notice one, and it's something that can be addressed, right? Maybe
sure.
it's stress related, maybe it's medication related, like it could be something else. But if you're seeing several of these, I would say that's your sign. We need to dig in a little bit deeper. And here's another thing: these are all very early signs to watch for because
Okay,
this kind of list is designed to guide earlier intervention because earlier intervention with cognitive decline leads to better quality of life and increased health and wellness throughout the process. So that's
right,
why we say look for these early signs.
right. Excellent. Great point. Okay.
So withdrawal from work or social activities. We talked a little bit about some of that social withdrawal with difficulty with using language. This is a little bit further than that. We've had some folks who are experiencing an early onset, so before age of 65. I had a gentleman who was still working, and he was like doing something with accounting his entire career, and all of a sudden Excel spreadsheets became insurmountable to him. He couldn't manage them, and that was his indication that there were things changing for him. Not wanting to come at all to a family event, I would say again, filter that through your loved one's personality. But not wanting to engage at all, I think would be a sign if that is new, if that is a new behavior for your loved one. And then not doing their own hobbies too. And again, there could be physical reasons for why a hobby becomes difficult. But if they don't have anything else to kind of fill that void, and you're seeing a lot of withdrawal, if nothing else, that could be an indication for depression. So it's still something we would want to address just from a quality of life perspective.
Great.
And then last, if you're seeing changes in mood or personality, and again, you have to filter this through who your loved one is at today, right? Their personality, what do you know to be consistent and true of them? But if they get particularly stressed, breaking outside of their normal routine, and that's new for them, if it becomes very like anxiety inducing to go someplace else, to not be in their little comfort zone of their home, their apartment, wherever they may be, or if they become very fearful and paranoid about things. Like I don't want to eat this because it's going to make me sick for some reason. So those would be kind of the indications that I would look at, especially if this is happening for somebody who's a little bit younger, because we could be seeing some of the different kind of diagnoses that maybe are impacting the frontal lobe if you're having a lot of personality changes. Another thing kind of becomes your social filter. If somebody didn't use foul language and all of a sudden that started, I would indicate we should probably examine what's happening here.
Right. Now that sparked a memory for me. My grandfather had Alzheimer's and passed away many, many years ago. But one of the first things, and this was, I mean, many years ago, he came out to visit me in California, and we had this whole trip planned to Catalina, and he was going to drive, and we had the tickets purchased, and he was taking all of us. And we woke up and there was fog because sometimes there's fog, right? And he was the level of anxiety, and he didn't want to go, and we canceled the whole thing. And of course, the fog cleared in like 45 minutes, but the discomfort that he showed was, very different than anything he had ever showed before. And that was kind of one of the first symptoms where you're like, huh, like his personality, that doesn't seem like grandpa. What is going on?
Yeah.
So I think it's again all those little kind of data points, and then looking back, you're like, okay, that actually makes a lot of sense. Uh, we had a question come in. Do you typically see that it's common for older adults to cover for these signs, or is it more common for the adult children to be in denial, or is it both?
I think again, this is really going to go to who people are as individuals, but I think it's a little bit of both, truly, because, and it's very normal, I think, to not want to feel vulnerable, like your cognition is changing, because if you're seeing these things very, very often, so is your loved one. They already know that some of this stuff is happening, and they may be in denial about it. And then from the adult children, my aunt was like this. You don't want to think that this could be happening to your loved one, because it's a really emotional and difficult journey. There's no sugarcoating that. And then also, I think there's a layer of fear of what happens to me when I get older then.
Right,
So I
right.
think like it's very complex. But I've also had families who've been incredibly proactive and like, hey, if this is a thing that's happening, I'm noticing this, let's address it now. So that we can increase quality of life for as long as possible as we navigate this.
Right,
Yeah.
right. Okay, so we're at Christmas dinner and we start noticing these, or we're together over a week's time. What do we do? What do we do? Right?
Yeah. So I'm going to say at Christmas dinner, probably not anything, right?
Fair,
I
fair.
would say just try to make your loved one feel as comfortable as possible and supported in those moments where they may be feeling a little bit extra stressed because they know they're trying to compensate for whatever's happening. And they may have not even named it yet. So, but I would then follow up. I would come back to them at a later time, one-on-one, where it's quiet and they can focus. And you can have a very open conversation from a place of compassion and love and concern. And again, we're not diagnosing them, so you shouldn't either.
Sure.
Like, don't tell
Good
your dad,
point.
hey, I think you have dementia, right? That's probably not going to be well received. But just, hey, I've noticed some things that you might need some help and support with. And I want to be here for you, is how I would approach it. And then I think one of the other first steps would be, hey, when's your next doctor's appointment with your general practitioner, with your primary care? And can I come? Can I come and support you with that visit? A lot of times those primary care doctors have a relationship with your loved ones, and they're going to be able to kind of look at the whole person, right? Not just test cognition, but holistically, what might be going on? Have we started a new medication? Is there a vitamin deficiency we need to address? All of these other things that can cause some of the symptoms that we talked about could help with a doctor's visit. And if your loved one is comfortable enough to have you come, that could be a really supportive thing to do.
Okay, I have a question.
Yes.
And again, thank you for this question, and I'm very sorry. My parents were in assisted living together for about 4 months when my dad passed away from Alzheimer's about a year ago. Shortly afterwards, my mom got sick. While she had been in the hospital, we noticed many of these signs mentioned back there, back in the suite. Since she has stabilized at this new normal level for her kind of repetitive questions, and she seems messier than she was once in her prime, we do notice that memory is more compromised if she is stressed out for some reason, but she rallies when the stress passes. Is it appropriate to accept this new normal and then be kind of on the lookout for the next stage of decline, or should they be doing something different? Is there any action they should take now because they are noticing some of these changes?
Yeah. So I think with an illness and a hospitalization, that can absolutely impact cognitive functioning, like no doubt about it. There's a condition called delirium, which can impact cognition. In older adults, especially, it can be very apparent. So I think what I would still do is I would want the doctor to evaluate, and maybe it's a situation where you ask for a referral to a neurologist because she might be experiencing what's called mild cognitive impairment, which can be a precursor to a further decline into Alzheimer's disease, but not always. So sometimes people just have this kind of new level where this mild impairment that isn't drastically impacting day-to-day life, but you can still kind of put things in place, lifestyle changes, sometimes medication to help stabilize that. So yes and no, I would accept the new normal, but also let's verify what this is. And if there's anything we can implement now to keep mom stable and healthy and happy as we go forward.
Okay. You had mentioned this, and I think we're all familiar, but dynamics, right? Family dynamics, especially with siblings. And we see that a lot within senior living communities as people are considering senior living, even if it's independent living, that there's a lot of opinions, a lot of differing opinions, and a lot of just history that we're never going to sort through. I know we had talked about like talking to the loved one privately if we see some of these concerning signs. Do you recommend you kind of huddle with your siblings ahead of time and approach them all together, or is it better one-on-one, or what do you have any strategies for success here?
Yeah, I think it's a matter of gauging how your family dynamics currently are and the relationships that you have with your siblings, if there's siblings involved. And I think, yes, having group conversations, especially if maybe you're the one who's in tune to some of these changes, knowing that you will very likely encounter denial in one of them at least. Again, my aunt was the holdout in my family, but understanding like that that's a possibility. And just kind of, I would come from it from a planning perspective of being prepared for the future, making sure that we're going to do right by our parents as they age, because there will be changes no matter what. Dementia or not, there will be changes. So I think it's good to have these conversations. And we kind of talk about that a little bit, I think, with some of the information on our next slide too.
Right, right. Okay. So we talked about encouraging a doctor's visit. Where do we start? And
Yeah,
again,
so
I've seen the slide, so I know, but
yeah,
right, we're starting
primary
with
care, I think, is
primary
your
care.
best point of entry into this.
Right.
Even if you're like, I know this is something changing in cognition, you're going to
Sure.
want to start with your primary because many insurance, Medicare groups, all of that are going to require a referral. So that's still going to be your first point of contact is primary care.
What does that look like? Again, I know that, right now our dear healthcare providers or our more overscheduled than ever and more understaffed than ever. And so we don't have a lot of time with them. But what if I'm accompanying, a loved one, what would that look like? What is that
Yeah.
conversation and what does that process look like?
Absolutely. So, and this is why I suggest if your family is comfortable having you go with,
Yep.
so that you can be there to be an advocate for them, and also share because we don't often like to say that something's not quite right. I've noticed this change in myself.
Right.
So, making sure that they know, first of all, that your loved one knows this is something that we need to bring up together to the doctor. I think my note of caution about this is always making sure that your family member feels that they are a part of the conversation, that they're
Okay.
not being talked over or like controlled by their kids, because that can kind of breed some frustration and resentment. They
Sure.
should always be a part of the conversation. But I think then you can ask specifically for, hey, we've noticed some changes in the way that my mom thinks or speaks or does these things or her balance. Can we look at, a cognitive assessment? Can we do kind of
Okay.
a full workup to understand what's going on, and start the conversation like that with the doctor?
Right. Well, and I know one of the things because I work with you, but you're very big on keeping that voice right throughout,
Yeah,
even when they're in full-blown dementia, right? They
yeah,
still have a voice. They still get to complete the survey to see how they're liking things. And you are a huge proponent, which is pretty unique in the space, to continue to have that voice. Any other commentary on that?
I just think that we often societally, number one, we don't value older adults. And then if they have cognitive impairment on top of that, we value them even less. And so we decide things for them when really, if you just take a moment to ask them, they will tell you what they like, what they don't
Right.
like. They
Right.
will, they will give you the information, even if it's in a different way than what you're used to. So I think we always need to try to do that and center the voice for us, for of our residents, and societally of people with dementia. And we can't just make decisions for them,
Right.
because
Right.
they can tell us.
Right. Maintaining that dignity throughout.
Yeah.
Absolutely. Great. Okay. So take steps to support them. Uh,
Yeah. So the first, I think, and simplest thing that we can do, is kind of take a look at the home and where they're living, whether that's in a senior living apartment already, whether it's in their own private home. What are ways that we can set up that environment to make it simpler to navigate, safer to navigate for them? Is it something that we need to look at? Their balance has changed. So should we get a shower chair? Should we immediately go through and pull up any throw rug that doesn't have like a sticky backing? This is a this is a fight I get in with my nana all the time, because we want to prevent falls. Do we need to set up reminders? We've got all of these electronic devices that can do alarms and call us automatically. So I would investigate that of how can I make their life easier in their home with their input. And if they're already in senior living, I would talk to the team at the senior living community saying, I've noticed these things. What have you seen? And how can we best support my loved one right now, where they are, and what are the options going forward if there are changes?
Great. Yeah, that's important. I did like how you called out in senior living because we do see this a lot. People start
Yeah,
sometimes even in an active adult and then they kind of advance to independent living and assisted living and then to memory care. So I know that we are on the lookout for those people and do assessments and so forth. But it is really important that, as a family member, your loved one best.
yeah,
You're going to notice if their personality has changed or if they're suddenly saying things that don't sound like them. So great. Have another question. Do you
yeah.
typically see these changes in a certain order or stage, like one following the next, or is it totally unique to an individual's decline?
Yeah, it's pretty unique to an individual.
Okay.
Things like language, for example, that's an easy one to kind of explain. If pre-cognitive changes, they were somebody who worked in a very social situation. Maybe they were a teacher, maybe they were an orator of some sort. Those social skills and language skills are heavily, heavily ingrained. Those aren't going to be the first thing that you see decline, right? You're going to see other pieces. Maybe it's memory impairment. Maybe it's the things like the balance or decision making skills, but the communication skills will still be very strong. So again, it's a very individual thing. So you might see two or three of these things. You might see eight of them happening at once. But every person, we have a phrase that we use it kind of in the industry. It's if you've met one person with dementia, you've met one person with dementia, because it's a very individualized process. We
Okay.
can predict decline, but how somebody goes through that journey is going to be very individualized.
Excellent. Thank you.
Mm-hmm. I think next steps too from this, you've made their home safe, is going to be talking about future plans and getting protections in place legally, right? If you have many siblings, talking to your parent about who do you want to make decisions. I think that's a really important thing. And what do you want those decisions to look like? So having those conversations with your loved one and then maybe pulling the whole family together to talk through this is what mom has decided, this is what dad says he would want, and let's talk through this as a family. So many of us don't have those conversations. Um,
Right. And I have some stats on that to
yeah,
share. It is very true and quite shocking, but it makes sense. These conversations are not easy to have. They're not pleasant. No one wants to have these conversations.
yeah. So if you haven't, you're not in the minority, right? So right now we've got more than 61% of people over age of 65 have not talked to their families about where they want to live if they aren't safe to live at home any longer. More than 53% have not spoken to anybody about who will help care for them when they need it. And then finally, it's another more than 59% have not talked about end of life care, which is so important. We need to know, right, as loved ones, what decisions somebody wants to make for how they would like their life extended or not, when perhaps they can't tell us. And I think these are conversations that are incredibly important in general, not just because you're noticing signs and symptoms of changes, because inevitably there will be changes in your loved ones as they age. And so we need to know what are their preferences and how can we honor those as their family members going forward.
Right. Is there a specific age we should start having these conversations?
I mean, I think you should have them like anytime, all the time. I think when people kind of hit retirement is a really good kind of reminder age of things are
Sure.
changing in my lifestyle because I'm not going into work every day. So it's kind of a fundamental shift in the way things work. And so that would be a really good time, I think, to really sit down and say, okay, like let's get the legal paperwork in order and let's talk about what we want probably 30 years down the road, right? It's not an immediate, but here's what I want if something were to happen.
Great. That's helpful.
And it's common at this point. So with Alzheimer's disease specifically as a type of dementia, 1 in 9 people over the age of 65 in America are currently living with this, which I think we showed on the first slide is just over 6 million people. So there are resources out there to help and support both people living with Alzheimer's disease and their families, because you need kind of different types of support through this process and resources. So there are often local resources through the Alzheimer's Association, the Alzheimer's Foundation, and Dementia Friendly. Like if you were to Google Dementia Friendly your city, you would likely find local resources right in your own backyard that set up education events and supportive safe places for people experiencing cognitive changes. And also you can usually find through those networks providers as well who specialize in this that can help and support beyond the way a general practitioner could. I think in addition to this, besides just the addressing clinically, medically what needs to happen for your loved ones, is also the social support, I think is really important. So support groups often available through the Alzheimer's Association, online and in person. And I would say if you're nearby a senior living community, especially one with a memory care, the likelihood is that they have a support group. I know all of our sites with memory care offer support groups for the family members that are open to the public. So there's no kind of anything, no requirement to be able to attend those things. It's just a community resource. The
Right.
other aspect of this is going to be looking into benefits, right? What's your insurance cover, your Medicare coverage? Because a lot of times there's kind of like secret things in there that you find that can be really supportive. So
Right.
your local veterans assistant or senior center can often help you make sense of some of those benefit packages as well.
Right, right. And I think, again, from an adult child, a lot of our benefits now that are being offered through our employer are geared toward that sandwich generation. And there's all kinds of employee sponsored benefits or employer sponsored benefits, rather, that have popped up in the last few years to support us, thankfully, with things like finding care, finding in-home care, finding a senior living community, just different resources. So make sure and check with your current employer to see if there are any things like that. And I do love, again, obviously, I work for Grace and I love all of our communities, but they do an amazing job with the Village program and having these resources where they invite folks in from the outside to learn, to educate. And that's definitely something we're very committed to educating and being kind of a hub or a resource for people just in general, whether they ever choose to live in a community or not. We want to be that resource because it is not something you want to face alone, right? I mean, aging in general it takes a village. There's a lot of things. But thanks for mentioning those things. I have a question. It says, we're starting to look at communities for my mom. It's a little overwhelming. What should we be looking for that shows that a community is truly offering person-centered care? I think everyone in this space uses person-centered care. What does that mean? What does that look like? And what should we be looking for?
Yeah, so I would question a little bit of how do you do person-centered care in your communities, right? What does that look like? How do your team members get to know your residents as individuals? What tools do you have that you're utilizing? And I think the other thing, especially if you're looking at a memory care space, I would really recommend spending time in that actual space. I find, I've been in the industry 17 plus years at this point, that people can get a little uncomfortable when they're in these spaces for the first time. And I think I would encourage you to just pause and sit with that for a minute, and look past what you're seeing on the top layer, right, of seeing people that are confused and living with cognitive challenges. And I would just spend a little bit of time, sit down and watch and see what actually happens in those spaces, because obviously I feel very strongly about the social support of people being in an environment where they're with people who are at a similar cognitive level, that feels safer for them socially to engage. And then you'll also start to see these personalities that really have an opportunity to shine, because we're supporting them in an environment that's easy to navigate. So some of that stress and anxiety is decreasing. So I would say sit in the memory care space. If that's what you're looking for, stay there for a while. Don't rush through that part of your community visit.
Right. I think also for any of you who have not been in a senior living community in the last many years, you will be surprised and delighted because it certainly is not the nursing home that both my grandparents and then eventually my father was in. It's very different. It's very vibrant. It's very lively. There is something going on around person-centered, and it's definitely much better and continues to get better with leaders like yourself, Ashley. So thank you. Um, one other kind of follow-up question to that. Do we bring mom with me when we look for the community? What do we do? How do we handle that?
Yeah.
It reminds me bringing back, my kids when they went to Montessori school. Like, do you just take them and drop them off, or do you like warm them up to it? Like, how does that work?
Yeah, so this is going to be very individual, but again, my stance is that your loved one should be as involved in the process as is manageable for them to be. So if you've got 10 communities on your list that you want to go vet, I wouldn't take them on that trip, right? So I would narrow it down, work with your family to decide on, we think this is the right spot. And then yes, if possible, I would take your loved one there, have them be a part of it, have them experience it, have lunch, sit in on a program, meet somebody, because this is going to be their new home. So I think anytime you can have them involved in the discussion and the process and experiencing it, that we should. I think that from almost a resident's rights and ethical perspective, that's the right thing to do. But
Sure, sure.
also, I think it's going to help your loved one understand even if there's not retention and carryover of the information.
Right,
I
right,
think it will help ease that process for
right,
most people. I'm going to
right. Okay.
star there for most. Yeah.
For most people. Okay. Very helpful. Thank you.
Mm-hmm.
Excellent. So I am going to, again, just open it up to see if there are any other questions that we haven't covered. Obviously, again, this is a heavy topic. We hope this is helpful, and we just want to make sure if there's anyone else that has questions. I'm happy to put you on live if anyone has a question they would like to ask, or we can just keep answering through the Q&A box. Ashley, is there anything, one thing I would like to dig into quickly, you mentioned it, and we'll definitely reference it in the material we send out after, but 5 wishes. Can you tell us a little bit about that?
Yeah, Five Wishes is an online resource that just can kind of help guide the conversation because, again, end of life, living will style conversations can be hard to have, and you might not even know where to start. So it's a good tool. And literally, if you just Google Five Wishes, you will see their form that you can download to help you guide that conversation. And I would even recommend doing that prior to going to a legal office to put a living will together because that can really be your template for doing that, and then coming up with your power of attorney um, uh, paperwork as well.
Great. Yeah, I think my sister's a healthcare provider, and she always mentions that Five
Yeah,
Wishes, and is always quite surprised that people don't know about it. But I didn't know about it until I heard about it from her. But it is a great resource. So thanks for digging in a little bit deeper. Just another question, comment. This has been so great. My grandfather had Alzheimer's. My parents are aging. Now is a great time for me to discuss these things with them. Really appreciate this. This is pushing me to make sure I talk to him sooner rather than later. And yeah, thank you for that comment. I think we hear that a lot. Like, I wish I wouldn't
yeah.
have waited so long. I wish I would have checked out my options earlier. I wish I would have asked these questions. Do you think that's quite common by the time people get to the village program?
I think that's
You're seeing a lot of
incredibly
that?
common. Yeah, I think it's incredibly common, even for assisted living. Oftentimes, we are not proactive about it. We wait until there's a crisis. I mean, my own family included, right?
Right,
When we really started to act was actually when my grandma passed away as the healthy partner, right?
right, right,
So she was taking care of my grandpa, and then suddenly we lost her, and then everybody scrambled because nobody had really had these conversations with my family. And
right,
so we had to piece it together the best we could. And I think looking back, we could have done better, right? If
right,
we had been
right.
proactive and talked to them.
Right. Yeah, it's easy to
Yeah.
connect the dots looking back, but that's
Yes.
why we do some of these education. So we are at time. So again, I just want to thank everyone. We will be sending out resources following, along with a way you can contact Dr. Ashlea Smalley if you have additional questions. And thanks so much. We will be sending out, we'll be hosting more of these great webinars. Our next topic is around the loneliness epidemic and what role senior living plays in that as far as building that community and connection. So happy holidays to everyone. Thank you again for attending and have a terrific day. Hello.